The aim of the project was to really understand what was happening in our public hospital emergency departments for people that were presenting with low back pain, understand demand, understand treatments that were delivered in order to make sure that we could design a more appropriate solution and deliver care that really improves the wellbeing of our community.
They told us that the pain was so impacting on their lives that it affected their daily activity, their function, put stress on their families and support services, that they could no longer manage pain, and attempts to try and manage pain through getting appointments, timely, accessible, cost-effective appointments was really challenging, and so people were coming to hospital as a last resort to get help.
I'm Professor Anne Burke. I'm the lead of the South Australian Chronic Pain Statewide Clinical Network in the Commission on Excellence and Innovation in Health, and the Co-Director of Psychology in Central Adelaide Local Health Network.
And I'm Joseph Orlando, physiotherapist from the Central Adelaide Local Health Network and PhD candidate with the University of South Australia.
This project began really in late 2020 when the South Australian Statewide Clinical Network for Chronic Pain was initially stood up in the Commission on Excellence and Innovation in Health. One of the first things we did was an environmental scan to see what we could see about the way that pain was impacting on our public hospital health system. And the data showed us that the primary pain-related reason that people were presenting to a South Australian Public Emergency Department was for low back pain. It also showed us, unfortunately, that they were waiting a really long time to access care that probably didn't align with best practice standards. So there was an opportunity for us to improve the way that we delivered care for our community, and in order to design a more appropriate solution, we needed to know more, so we decided to dive deeper.
This study was undertaken over 2 stages using mixed methods. The first was a quantitative study that looked at data of people that presented to a hospital emergency department with back pain. And the second part was a qualitative study where we interviewed people who presented to hospital for back pain to understand their reasons and the factors that led to their hospital presentation and admission. So when we looked at data of people that presented to a public hospital emergency department, and these included regional and metropolitan hospitals in South Australia, from the 12,000 presentations that we analysed, 1 in 3 arrived via an ambulance, which is quite high considering the national average for ambulance arrivals across Australia. We also found that the majority of patients were categorised or triaged as low urgency, so either a category 4 or 5, and typically this cohort wait the longest in a hospital to be seen. Very few required spinal imaging or other investigations. Only 10% required some form of X-ray or CT scan. And the vast majority, over 50%, were able to be discharged back to the community without requiring ongoing hospital care or admission. In fact, hospital admissions was only was under 30%. So it tells us that a lot of people come to hospital for back pain, and they require very minimal intervention. They may be prescribed an analgesic and then sent back home to continue their care. But when we delve deeper to understand people's experiences and the reasons that they came to hospital, they told us that the pain was so impacting on their lives that it affected their daily activity, their function, put stress on their families and support services, that they could no longer manage pain, and attempts to try and manage pain through getting appointments, timely, accessible, cost-effective appointments was really challenging, and so people were coming to hospital as a last resort to get help. So there's clearly a big gap between those that require emergency care, life-threatening conditions, and then trying to access community care. And so we've tried to fill this gap, identifying that people with back pain need help, they need timely appointments. It might not be an emergency, but then they can't get the care that they require, as our guidelines say, in the community. This project was a collaboration between the South Australian Chronic Pain Statewide Clinical Network with the Commission on Excellence and Innovation in Health, the University of South Australia, and the Central Adelaide Local Health Network. And it was funded through the Hospital Research Foundation and the Health Services Charitable Gifts Board through an allied health grant and through the orthopaedic department.
This is really important research for South Australia, and as Joseph said, it's an exciting collaboration between a large number of local and national partners. Once we understood the impact that low back pain was having on our healthcare system and the impact that the type of care that we were delivering in that setting was having on our community, we knew we needed to do better. So we set about designing an optimal system of care for low back pain, co-designed with a range of experts, clinicians, consumers, researchers, health service executives, all coming together to improve the way that we delivered pain care for our community. As part of that, we knew we also needed to facilitate access to trusted and appropriate information about low back pain. So again, with consumer and clinician partners, we reimagined the SA Health low back pain web pages to be a trusted repository of high quality information about low back pain and options for managing it. We also developed a 2-minute educational video that really runs through what we know about pain science and what that means for understanding what's happening in our bodies, all designed to empower individuals to better respond to pain and to know how to manage things themselves, and indeed when to seek help. From a research perspective, we've also got a huge number of exciting collaborations happening. There's a lot of people getting involved in this initiative, which is fantastic. So we're working with our partners in SA Ambulance Service and in Central Adelaide and Southern Adelaide Local Health Networks to really unpick ways to better manage low back pain from an ambulance perspective, and then to be able to smooth and improve transition to care and appropriate pathways for people as they transition towards hospital-based or other services. We've got a pilot running with our partners in Central Adelaide Local Health Network in the urgent care hubs in Woodville and in Sefton to deliver a high quality alternative for people who would otherwise be seeking care for low back pain in the emergency department. And that's having really promising results. And then based on that, we're now starting to move into an exciting phase where we are designing a proof of concept project to deliver and develop a digital pathway for low back pain, to really create community-based resources for individuals to access, and then to have that linked in a facilitated and coordinated way with more acute services, so that we can facilitate access to care and smooth the transition across the continuum of care as care needs for low back pain change. So as you can see, there's a lot that's happening in this space, and so this work's been really important, and for us I think it speaks clearly to the importance of high quality health data being used to drive health system innovation and reform.